Tens of thousands of people are dying every day from high blood pressure. It is believed that 2.1 billion people worldwide have this disease. And in the United States alone, there are 85 million people with high blood pressure. Do you have high blood pressure? Or do you know someone with high blood pressure? When was the last time you had your blood pressure checked? Do you want to learn about this disease? Well, welcome to Get Healthy with Dr. Cooper. My name is Dr. Cooper-Dockery. I'm board certified in internal medicine. I have been practicing medicine for over 27 years. I have helped a lot of patients with their chronic diseases. I am here for you too. So don't go away, I'll be right back.
Now it's our turn to take care of those who saw and helped us grow. Their time is valuable. It is time to think of a professional staff who will help take care of them. We at PalliMed Hospice and Palliative Care are the right choice. Our staff and 24/7 services are trusted and reliable. Call us. We are the solution you and your family need. We understand you. We are PalliMed Hospice and Palliative Care.
Hey, do you have high blood pressure, diabetes, hypertension, cancer? Well, come over to Cooper Wellness Center. We have raw organic juices filled with vitamins and antioxidants, good for any diseases. So come over to Cooper Wellness Center and ask for one of our juices, and we will serve you up something that will give you long, healthy life and help you to lose weight and get off your diabetes medication. Come to Cooper Wellness Center. Welcome back to Get Healthy with Dr. Cooper. In our program today, I have a friend of mine, Dr. Andrew Levine. He's a specialist in hypertension and kidney disease. So Dr. Levine, welcome to Get Healthy with Dr. Cooper. Come right in, and I'm going to ask you a couple of questions, Dr. Levine.
Well, Cooper.
Welcome.
Thank you.
Dr. Levine, tell us a little bit about yourself.
Well, I'm Dr. Andrew Levine. I'm a kidney specialist. In my specialty, I take care of hypertension, which is the topic today.
That's right.
And it's really amazing how in the world we have lots of issues with high blood pressure. As you mentioned, many people know or they don't know that they have high blood pressure.
But you know what? They're probably thinking, so what is hypertension? Why don't you tell us, how do we define high blood pressure and why do we have blood pressure anyway?
Yes, we have what's called high blood pressure, but actually it should be called high arterial pressure because that's what we measure, the pressure in the arteries. Mm-hmm. There is a way of measure the pressure in the veins, but commonly we just measure the arterial pressure. Mm-hmm. So,
is there a number, a cutoff number for high blood pressure?
Oh yes, absolutely. The normal pressure is 120 over 80, mm-hmm. or less than that. When we measure two pressure, is one called the systolic pressure. It's the one that we measure when the heart contracts.
Right.
And when the heart relaxes, we call it diastolic blood pressure. Basically, that's what we have.
Is there a range? Because, you know, sometimes patients come to me and they say, doctor, my blood pressure is 139 over 90. Should I worry? Is there a range? Do we have normal blood pressure? Do we have pre-hypertension? Do we have hypertension? What is the range that they should worry about?
Well, that's a good question. The normal blood pressure should be the systolic pressure less than 120.
Okay.
And the diastolic pressure less than 80.
Right. So what if it's between 121 and 139? Should they be worried?
Absolutely. Should be worried because we let that pressure going for years. That causes end organ damage. I mean by affecting the brain, the heart,
the kidneys.
And the kidneys, of course.
Right.
Yeah.
So today we're going to explore a little bit about causes because the viewers might be thinking, so should I be worried? Am I at risk for high blood pressure? why don't we walk over there and we're going to talk a little bit about the causes of hypertension. Come along with me, doctor. All right. So we're saying that hypertension, it should be about 120. I mean, normal blood pressure should be about 120 over 80. And then anything above that, we should worry somewhat. Am I right?
That's correct.
Okay. Now let's look at the causes. What are the causes of hypertension? Let's talk, Dr. Levine.
Well, there are some causes that we see. One is genetics. There are some races in human beings that have more blood pressure than others. Obesity is another cause.
Right.
You know, since I think for the past about 50 to 60 years, we indulge in not eating right, like preserved food and all that. So that can cause high blood pressure.
Okay, why is it that patients who are overweight have high blood pressure? Why?
Well, there is lots of causes in that, we can call it. Number one is they tend to not exercise.
Well, that's true.
That will get obesity. Your arm gets thicker. So there is more volume in your body. It has to do with fat.
Yes, and more volume in terms of blood. It is
That's
believed that patients who are obese have more blood volume, and they also have more resistance. So as the blood passes through the artery, there has to be more pressure. There's more pressure, and then that could be one of the causes for hypertension. What are some of the other causes? Patients sometimes are concerned about medication. Are there any drugs that could cause hypertension?
Well, illegal drugs.
Cocaine.
Cocaine, one of them.
Right.
Is, there are some others, many, that people, humans being indulged into that can cause hypertension. But I think the one we have most of the problem is cocaine, crack,
steroids, pain
medications.
We have to be very careful. I had a patient
analgesics.
Yes, right. Had a patient, young woman who came to my office recently, and she came with a stroke because of high blood pressure.
Yeah, we call it the silent killer.
The silent killer for a reason. Why is it called the silent killer, though?
Many people don't have any symptoms until the blood pressure is too high. And then we end up with issues with the heart, you know, weak heart, enlarged heart, issues with strokes.
That's right. As a matter of fact, I have something here I wanted to show. Now, we're going to simulate high blood pressure here. Now, I hope my cameraman can focus right on this experiment here. So therefore, if we simulate the heart, you said pumping the heart, pumping the blood gives the pressure. So when we push here, the blood should flow nice and easy. Now, when someone has very high blood pressure, what happens in the brain, for example, there could be, when the pressures increase, what we see, bleeding in the brain. You can see there. So there's rupture of the blood vessel and bleeding in the vein, in the brain. Many times, this is at this point the diagnosis is made. That is why it's called the silent killer.
Correct.
Because the pressure becomes high, the blood vessel ruptures, there is significant bleeding in the brain, patient can die or have paralysis. So this is a problem. Now, let's talk a little bit about, you know, treatment, for example. How do we treat hypertension?
Well, someone who doesn't have a very high pressure, so we check into the modification factors.
Yeah, lifestyle
like
modification.
Lifestyle modification, less stress, good diet.
That's right. You mentioned stress, right? How does stress lead to high blood pressure? Let's talk a little bit about that, because most of us are stressed. Am I right?
That's correct.
So let's see.
We actually live in a fast world.
Yes, with a lot of stress.
A lot of stress, financial stress, you know.
Family stress.
Family, living beyond our means, trying to catch up. This is a factor that we see even young people having heart attacks with high blood pressures and strokes. So we see most of now.
Here now we have some of the causes here of hypertension. You mentioned obesity, you mentioned inactivity. What about alcohol? A lot of people don't know that alcohol can lead to many diseases, even high blood pressure.
Yeah, alcohol is a very interesting drug. We call it a drug. People tend to drink too much,
That's right.
excessively. So that causes many changes in the body. Alcohol is one of them.
Hypertension is one of them.
And hypertension.
And of course, people have some predisposition for hypertension, genetics.
That's correct.
But I always believe that genetics, your genes load the gun. However, lifestyle will pull the trigger. So even though someone is predisposed, mother or father have hypertension, if one lives a healthy lifestyle, then we can blunt the disease. Smoking. Smoking is also a big risk factor for many diseases, heart disease, cancer, hypertension. So if someone smokes, they should try to quit smoking. Let's jump over to salt. Salt is a big risk factor.
Since the invention of preserved foods, people eat a lot of lots of salt.
Right.
Definitely, most food have salt.
That's right.
And we always say that we should eat like 2 grams of sodium. That's basically less than a teaspoon.
Yes.
Not even a teaspoon.
Yeah, the max is just a teaspoon. 2 grams of sodium a day, I agree.
And most people eat 4 or 5 grams of sodium a day.
That is a problem.
Amount of sodium.
Right.
And that increases the volume in our body. And as a result, our blood pressure goes pretty high.
And we already mentioned stress. With stress, the body will secrete hormone called adrenaline, right?
Correct.
The adrenaline causes the heart to beat faster, pump the blood faster. That can increase blood pressure. You know, Dr. Levine, I have Adrian on the road trying to get questions about hypertension.
Once again, Dr. Cooper, I'm here with Ms. Jones, and this is what she wants to know.
I would like to know what are the medical issues associated with high blood pressure?
All right, that's a very good question. What are the complications? Dr. Levine, you see this every day in your office. Tell us, what are the complications of hypertension?
Well, we start with our brain, strokes. And then we go to the heart can enlarge and person can get a condition called congestive heart failure or thickened heart.
Right.
That the heart doesn't pump right. It gets to the point that it gets pretty weak.
Very weak, get dilated and just fail.
Yeah, we had issues with the eyes. You know, had hypertensive retinopathy. People can get blind from that.
That's right.
Other conditions, like in my specialty, kidneys.
Kidneys. Here,
Hypertension or high blood pressure is the second cause of kidney failure. Diabetes is number 1, hypertension is number 2. And most people with diabetes and hypertension, they got into kidney failure. In a way, with kidneys don't work anymore and
we need
require.
our kidneys because a lot of people end up in dialysis. So we have to make sure that our viewers understand that hypertension is a problem and can lead to many diseases. Let's see if Adrian has any other questions.
Hi, Dr. Cooper. I'm here with
Jaime.
He has a very important question for you.
Hello, Dr. Cooper. How do I know if I have high blood pressure return?
That's a good one. How do they know? We said it's a silent killer. What should they do to know if they have hypertension, Dr. Levine?
Well, it's pretty easy. You don't need to go to a doctor to have your blood pressure checked, but now many pharmacies, even stores, supermarket, they have machines there or equipment that checks the blood pressure. If your pressure is abnormal, so you go seek to a doctor. Remember, if the blood pressure is over 120, systolic, so something is wrong with your blood pressure.
So therefore, they should make sure the number is about 120. All right, let's see if we have another question.
Hi, Dr. Cooper. I'm here with
Carlos Portales.
and he has another very good question for you.
What changes can I make to improve my blood pressure?
All right, I want to answer this. What are the changes? All right, so therefore, there's so many changes one can do to prevent high blood pressure. One, your diet. Remember we spoke about salt. Decrease the salt intake. That's number one. Remove caffeine from your diet. Remove alcohol. If you're overweight, lose 7 to 10% of your body weight. Exercise. Relax. Get enough sleep per night. There's so many lifestyle changes that you can do in order to prevent or even improve high blood pressure. Dr. Levine, it has been a pleasure having you here today, and I hope to see you again soon.
Well, thank you.
Don't go away. We'll be right back with more on high blood pressure. Hey, do you have high blood pressure, diabetes, hypertension, cancer? Well, come over to Cooper Wellness Center. We have raw organic juices filled with vitamins and antioxidants, good for any diseases. So come over to Cooper Wellness Center and ask for one of our juices, and we will serve you up something that will give you long, healthy life and help you to lose weight and get off your diabetes medication. Come to Cooper Wellness Center.
Now it's our turn to take care of those who saw and helped us grow. Their time is valuable. It is time to think of a professional staff who will help take care of them. We at PalliMed Hospice and Palliative Care are the right choice. Our staff and 24/7 services are trusted and reliable. Call us. We are the solution you and your family need. We understand you. We are PalliMed Hospice and Palliative Care.
Welcome back to Get Healthy with Dr. Cooper. Did you know that 90% of chronic diseases can be cured with exercise? Exercise is indeed medicine. Today we have medicine for you. Let me ask Ramsey. Ramsey, come along with your team.
How you doing, doctor?
Great. What do you have for us today? Go on.
Today we have a leg workout. We're gonna get this done really quick. Trying to get you guys to do this in the comfort of your home. Okay? Please distinguish beginner and advanced. If you're beginner, you're less than 6 months doing exercise. If you're advanced, you've been doing exercise for consistently more than 6 months. Okay? We're gonna get into the basics of it. We're gonna go into a squat. Let me get you to do a squat real quick. Come up, all the way down. Up, there you go. Okay, now turn to the side so you can see it. She's focused. Notice how she's going all the way down and all the way up. I really want you guys to go all the way down in a 90-degree angle on your knee. If you can go lower, push it. Again, this all depends on your ability of your body. Okay, we want to do this maybe 3 to 12 times just to come on in and get you warmed up. Okay, now we're gonna go to advanced. The only thing that's different on advanced, again, we're going low, coming up, going low and coming up, but we're throwing the hips forward, squeezing the butt. Go ahead and turn to the side. Now you're gonna notice that hip thrust. Boom. 1, 2, again, 3. Now for advanced, we want to do this a good 3 to 4 times, 3 to 4 sets of 15. Okay. This one, again, you've been doing exercise more than 6 months. You should be able to attain it. You will be feeling a little bit tightness in your legs, so be careful with that. Next, we got a plank. A plank is going to be, for a beginner, it's going to be on your knees. You're going to come all the way down to your floor, on your elbows, bring your hips down, hold. Right there, we're going to hold 30 seconds, breathe, breathe, breathe. Again, if you have a cell phone right in front of you, put the timer, get 30 seconds in. After that, we're good. For advanced, now the knees are off the floor. We're holding, same thing. This should be attainable since you have been doing 6 months of exercise. So there's no excuses of not having the knee off the floor. Okay, focus again. We're gonna do this both 6 times, 30 seconds, total of 3 minutes. Total of 3 minutes, okay? Next, we're gonna get into the lunge. Lunge, lunge, lunge. Go ahead and get up on your ladies. Thank you, thank you, thank you, thank you. Okay, so come on forward. Show me the lunge. Okay, big mistake. Okay, so we really need to be careful and cautious of the knee passing the foot, okay? If we have this is prone to injury. We want to avoid injury as much as possible, especially at home. I mean, nobody wants to get called the ambulance, call the ambulance because your knee messed up, okay? So really focus on extending the leg. Extend the leg. There you go. We're still not going past. Let's go. Extend the leg. There you go. Right there. One more. One more. There you go. Good job. Bring it back. That's just the basic. Okay. That one we're gonna do 10 and 10 on each leg. 4 sets. 4 sets. 10 and 10. 20 total. Now we're gonna go to advanced. Advanced. All it's gonna add is a twist. Trunk twist. Boom. Now we're coming back up. Left leg. Notice how her knee does not pass the foot. Come back up. One more, one more. Twist. Good job. Now the left leg. Now the left leg. Now what we're doing, we're coming up. We're gonna do a lunge get up, okay? We're gonna focus on coming up. Just with one leg, you lift the back leg and you're coming up. There you go. She got it. Come up. This is really gonna get your quads going, your glute, your hip flexors, a little bit of hamstring, but we'll get the whole leg involved. Now I want these 15 to 20. I just want 2 sets, just so we can get that movement going. Now we're gonna go to advanced. Advanced is gonna be a little bit tougher. So now we're gonna be coming up and jumping. Coming down and jumping, okay? So really, really emphasize the jump. There you go, up, boom. This one, again, this one we're gonna try to go 15 to 20. This one we're gonna push 3 times, not the 2 like over here. We're gonna go 3 to 4, okay? And now we got the high knees, guys, high knees. Basic high knees gonna be on this side. Nice and controlled, one at a time. Anybody can do this, no problem, okay? Now for the advanced section, we're gonna come a little bit faster. No pause, no pause. Going up, going up, going up. Hard, 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 fast, fast, fast. High intensity, okay? Go ahead. Now that we're gonna go 30 each leg, okay? 30 taps each leg. Now we're gonna go 4 sets. Over here we're gonna go 10 and 10. Again, 20. Get you into the rhythm things. Get you into the rhythm of things. This one I want 4 sets. 4 sets in total. Last, all we're doing is a static squat. This is just gonna get us to finish off the leg workout. All we're doing is bobbing right here at the bottom. 1, 2, 3, up. 1, 2, 3, up. This one I want 15. 3 sets to 4 sets. Again, this is at the end of the workout, so depending on how your body's feeling, if you can hit that 4, hit that 4. If not, stay at that 3, you'll be good. Now, on the advanced portion, we're gonna go squat, 1, 2, 3, explode up. We're jumping, 2, 3, up. There you go, 1, 2, 3, up. Good job. Now that one, we're gonna go 15. Now we're gonna go 3 to 4 sets again, depending on how your body's feeling. Work with it, work with it. And that's what we got for today. That's our leg workout. Now, Dr. Cooper, come on in.
Ramsey, thank you so much. Great job, everybody, great job. You know, you out there, make sure you do this 30 minutes or 45 minutes every day for 6 days a week, and we'll see you again next week. Bye-bye.
Now it's our turn to take care of those who saw and helped us grow. Their time is valuable. It is time to think of a professional staff who will help take care of them. We at PalliMed Hospice and Palliative Care are the right choice. Our staff and 24/7 services are trusted and reliable. Call us. We are the solution you and your family need. We understand you. We are PalliMed Hospice and Palliative Care.
Hey, do you have high blood pressure, diabetes, hypertension, cancer? Well, come over to Cooper Wellness Center. We have raw organic juices filled with vitamins and antioxidants, good for any diseases. So come over to Cooper Wellness Center and ask for one of our juices, and we will serve you up something that will give you long, healthy life and help you to lose weight and get off your diabetes medication. Come to Cooper Wellness Center. Welcome back to Get Healthy with Dr. Cooper. We are in the kitchen segment, and I have Chef Edgar. Chef, welcome.
Hey everybody, how y'all doing? Welcome, welcome, welcome. We have an exciting day for you all.
Very good. We have been discussing high blood pressure, the silent killer. And we have some superfood for you today that will indeed lower your blood pressure. What do we have, Chef?
Today we're going to have our spinach and kale green smoothie.
That's right, spinach and kale smoothie.
Yes, it is.
Are you going to add anything to that, Chef?
We're also going to add an apple, water, and our special Cooper Wellness protein.
That's right. Now, spinach and kale contain lots of folate and lots of vitamin B. This is superfood for the brain.
Yes, ma'am.
You know that?
Yes, ma'am.
And not only that, these green leafy vegetables have nitrates Nitrates will increase the nitric oxide to dilate your blood vessel and lower your blood pressure. Chef, why don't you go ahead?
Okay, let's start. We have 1 cup of spinach. Okay, we have 1 cup of kale as well. We have 1.5 cup of water, and we have 1/2 cup of ice. We also have an apple. This apple we are going to leave the peel, but only thing that we're going to take out is the seed and the core from inside. Okay, so we're going to cut these in 4. Very simple to take out the center part, put it in an angle, and we're going to get that center out. Okay, get the seeds out, get the stems out. We're going to leave everything else in there.
And you know, apples are filled with vitamin C. So if you do not want to get sick and to build your immune system, then all of these vegetables and the apple contain good vitamin A, C, as well as E. Go ahead, Chef.
Now we're going to put all of this into our blender.
There we go.
So we get our spinach and our kale.
Are you going to add the ice first, maybe?
The ice and the water. Get our liquids in there. If not, your blender will not mix correctly.
Yeah.
So get our liquids in there. Now we're going to put our spinach.
Now, if you don't want to have osteoporosis, spinach is what you need to consume because spinach is high in calcium. All right, Chef.
Now our kale will go in there. We're going to mix our greens up, then we'll add our apple, and then we are going to add our protein as well.
That's right. And remember, here at Cooper Wellness Center, we have plant protein for you. All right.
Here we go.
Excellent.
So now we have everything going. Now our apple is going in. There's no seeds, there's no stem, there's no core, but we get all those nice vitamins that we need. We're also going to add 1 cup of our protein, vanilla flavored. This is a plant protein. This is awesome for your body. This is especially what you need.
That's right. And there are 25 vitamins in that 1 scoop of plant-based protein, which you can obtain right here at the Cooper Wellness Center. All right. We have it online. So if you're not living in the Rio Grande Valley, you can find us online at cooperwellnesscenter.com and you can order your protein shake.
21 grams of protein in 1 scoop.
Wow, that is a lot. Now this is a complete meal for breakfast. You could have it for breakfast. You could also have this for supper. All right, Chef, I think we should taste that and see how delicious this is.
It smells delicious.
That is yours and this is going to be mine. All right, let's see. Very good. Let's see what it is. Very good. So delicious.
This is a great breakfast.
Breakfast or even supper.
Great
Filled
way.
with vitamins, filled with omegas, filled with a lot of fiber. So for more recipe, visit our website www.cooperwellnesscenter.com and we'll see you again soon.
Yes, ma'am.
Thank you.
Yes, ma'am.
Hey, do you have high blood pressure, diabetes, hypertension, cancer? Well, come over to Cooper Wellness Center. We have raw organic juices filled with vitamins and antioxidants, good for any diseases. So come over to Cooper Wellness Center and ask for one of our juices, and we will serve you up something that will give you long, healthy life and help you to lose weight and get off your diabetes medication. Come to Cooper Wellness Center.
Now it's our turn to take care of those who saw and helped us grow. Their time is valuable. It is time to think of a professional staff who will help take care of them. We at PalliMed Hospice and Palliative Care are the right choice. Our staff and 24/7 services are trusted and reliable. Call us. We are the solution you and your family need. We understand you. We are PalliMed Hospice and Palliative Care.
Many people are afraid of the word dialysis, hemodialysis. Why do we put patients on dialysis? Chronic kidney disease is a problem in the United States and the world. There are 31 million people living in the United States with chronic renal failure. Worldwide, 1 in every 5 men has this disease, and 1 in every 4 female will have this disease. So what do we do? Why do you have chronic kidney disease? And why does chronic kidney disease lead to death? My name is Dr. Cooper-Dockery, and welcome to Get Healthy. Get Healthy is a program designed to assist you, the viewer, in learning how to prevent, reverse, or cure chronic diseases. So today, the topic is chronic kidney disease. So welcome again to Get Healthy with Dr. Cooper. I am Dr. Cooper-Dockery. I have been practicing medicine for the last 27 years, and I've helped many patients reverse their diseases or reduce their medication. Don't go away. We'll be right back with more on chronic kidney disease. Hey, do you have high blood pressure, diabetes, hypertension, cancer? Welcome over to Cooper Wellness Center. We have raw organic juices filled with vitamins and antioxidants, good for any diseases. So come over to Cooper Wellness Center and ask for one of our juices, and we will serve you up something that will give you long, healthy life and help you to lose weight and get off your diabetes medication. Come to Cooper Wellness Center.
Now it's our turn to take care of those who saw and helped us grow. Their time is valuable. It is time to think of a professional staff who will help take care of them. We at PalliMed Hospice and Palliative Care are the right choice. Our staff and 24/7 services are trusted and reliable. Call us. We are the solution you and your family need. We understand you. We are PalliMed Hospice and Palliative Care.
Welcome back to Get Healthy with Dr. Cooper. Today we have a very exciting topic for you, and that is chronic kidney disease or chronic renal failure. Many people are afraid of this disease, but we have lots of information for you today. I have a friend of mine in the studio, Dr. Andrew Levine. Welcome to Get Healthy.
Hi, Dr. Cooper. It's a pleasure to be with you in this occasion.
It's a pleasure having you. Tell us about yourself.
Well, I'm Dr. Andrew Levine. I'm a certified kidney specialist or nephrologist.
And you have a very busy practice in the Rio Grande Valley in South Texas, am I right?
Oh, absolutely. We have too many problems with kidney failure, kidney disease.
Right. We have a lot of diabetics and have a lot of patients with high blood pressure, and these are two of the main causes for chronic kidney disease, am I right?
You are absolutely right. It's a big problem that we have. The patients really keep us busy with kidney disease.
Right. What is chronic kidney disease, by the way?
Well, a kidney disease is when the kidneys don't function properly. They cannot keep up with the health of the body. The kidneys are organs very essential for health.
Right. How do you define chronic renal failure, though? Are there different stages?
Yeah, absolutely. We stratify that in stages 1 through 5. So the stage 5 is the one that requires this special treatment called hemodialysis or peritoneal dialysis.
Yeah, we're going to get there. But how can our viewers know if they have normal kidney function, stage 1, stage 2, stage 4?
Yeah.
What can we tell them?
Yeah, one of the questions that I usually ask is, you know, how do I know I have kidney problem, right? So one of the first symptoms is when you get up at night to urinate quite often, provided that you don't drink water before to sleep.
Yeah, and that is so general, because if a man has prostate problem, then he can get that. So you know what? Let's go over there. We're going to look at the location of the kidneys. A lot of patients don't know where the kidneys are found. Follow me and let's look where the kidneys are found. Alrighty, so here we go, Doc. So this we have the torso. Now, are the kidneys found up here? Are they here? Where are the kidneys, Dr. Levine?
They're usually in the back, up
right
here. Yeah, up here.
Right,
this
right
area here. Okay, many people come with back pain and they say it's the kidney, but actually it's not the kidney, something else.
Right, so the kidneys are behind the intestines, right?
That's right, all the way in the back.
And how many do we have? 1, 2, or 3?
Yeah, normally we have 2.
That's right.
Yeah.
But someone can live with 1 kidney, am I right?
Absolutely, that's correct.
Alrighty, here we have a diagram of the kidney. So Doc, you want to just tell us something briefly about this right here, very brief?
Yeah, the kidney is a very complex organ. It's not that big, by the way.
Yeah,
it's
very
tiny, but it has a lot of function.
All right.
You know, clears our blood from
right.
substance that we eat regularly.
That's right.
Medication, food.
Everything. It has to go through a filter system.
It's a filter.
Right, and we have a system here. We're going to leave it at the last, and we're going to discuss this filter system. But you know, Dr. Levine, some people might be wondering, what are the causes? We already defined that chronic kidney disease is when the patients are not, when the kidneys are not functioning well. And there is a number. We have the GFR, glomerular filtration rate, right?
That's correct.
We have normal, that if it's below 90, that is stage 1. If it's below 60, stage 2, below 30, 3, and so forth, right?
That's correct.
So, audience, if you're listening to us, you can ask your doctor, what is your GFR? The doctor will say, oh, this person is very educated. And then you'll know if you have kidney disease. But let's look at some of the causes of kidney disease. Doc, one of the number 1 cause.
By far, the number 1 is diabetes.
That's right.
Sugar.
Sugar. So here we have it here. And we can see here that 44% of kidney disease or chronic kidney disease is due to diabetes. And then the next culprit, Doc.
Follow hypertension.
High blood pressure. And then we have others, medication, other diseases that can lead to kidney failure. All right, Dr. Levine. Let's go here, Doc. Since diabetes is the number 1 cause, I brought this on. So this here is our blood vessel. In the blood vessel here, it has sugar, right?
Correct.
Because sugar is the culprit. The kidneys are supposed to be filtering the sugar, right? So that the sugar gets back in the blood. So let's put some sugar in our filter. This is the kidney we're going to filter. What's going on there, Doc?
We're filtering the sugar.
But the sugar is falling back into the kidney. What is wrong right here? What is this? What do we describe this as in the kidney?
Well, this is like a membrane.
Right.
So, sugar clogs the membrane.
So
and
the
then
high
it causes
sugar
a lot of problem with the kidney. The kidneys don't
can't
work.
filter.
Cannot filter.
So the
anymore.
high sugar will damage the membrane, the membrane here, and therefore we're going to have sugar getting out in the urine. Right?
That's correct.
We're going to have protein getting out in the urine. And that's one of the first sign of kidney failure in the diabetic when we do the urine test and we have sugar in the urine. Am I right?
Urine and protein. Yes, correct.
Urine
yes,
and, yeah. Sugar and protein. So if you're listening to us right now, make sure you speak with your doctor and ask your doctor to check if you have sugar in the urine or protein in the urine. What are some of the other risk factors, doctor, for chronic kidney disease or chronic renal failure?
Okay, one of the important factors is people don't drink water anymore. We're provided plenty of water. Actually, the world has more water than anything else.
That's right.
And now we indulge into getting into high sugar contained beverages.
That's right.
Sodas,
Power drink and all of that.
drinks. And we don't drink water.
And how much water would you recommend for a normal person with normal kidney function?
Well, we should drink about 2 liters of water a day.
That's right, which is about maybe 8 glasses. Or you can check your weight and go half of your weight in ounces.
That's correct.
And that's the amount of water you need. So water is important. And of course, if you have high blood pressure, make sure you control your blood pressure, because hypertension is a huge cause for renal failure. If you're diabetic, see your doctor. Reduce the sugar so that will protect your kidneys, so your kidneys will filter. Because if the kidneys don't work well and they don't filter, what happened to all the toxin and the poison? What happened there?
They just get accumulated in the body, makes you sick.
That's right.
Actually, when people get to a level of stage 5 of kidney failure, is when they start getting the symptoms. Initially, there is no
There are
symptoms.
no symptoms, right.
You know, then it started with nausea, vomiting,
Swelling.
memory goes away, starts swelling up. So that's when
Shortness of breath.
Yes, shortness of breath. But fluid accumulates
That's
in
right.
the system. So it will require dialysis.
So your kidneys are very important. You want to protect your kidneys. We do know that with one kidney, you can stay alive. But you want to protect both kidneys so that you will enjoy good health. I have Adrienne on the street getting questions about kidney disease. Let's go to Adrienne.
Hi, Dr. Cooper. I'm here with
Judy.
and she has a very important question for you.
Hi, Dr. Cooper. I just wanted to know, how do I know if I have kidney failure?
Doctor, how do people know if they have kidney failure?
The best way to see if a person has kidney disease is by doing a test. A blood test, it'll tell you the percentage of your kidney function. It's called the glomerular filtration rate. It tells you exactly where your kidney is. It's a simple test. There are the more sophisticated tests, but that's the main one that we do. It's a one, and then check a urine to see if there is any presence of protein in the urine.
Right, and remember we said there are no symptoms. So you could have kidney failure and do not know it until you get to the emergency room with shortness of breath, with vomiting, with confusion. At that point, you're in the late stage and maybe needing dialysis. All right, let's see if there's another question from Adrienne.
Dr. Cooper, right now I'm here with,
Ivan.
and this is what he wants to know.
Hi, Dr. Cooper. How can I prevent getting kidney failure?
Our audience probably are asking the same question, Dr. Levine.
Very interesting question. Prevention.
That's right.
So, number one, you have to test to hear at what level of kidney function you have any kidney disease. Okay, the other thing is drink enough water. Be careful with what you eat and drink. Especially medication. We have big problem with medications causing kidney problems. Everybody experiences pain, chronic pains, and they started taking ibuprofen, Aleve, or some other kind of medication similar to that. And chronic use can cause kidney problem. Make sure that you don't get dehydrated. Water is your best friend.
Very good. So remember, audience, look at the two main causes for chronic kidney disease. That is diabetes. You need to prevent yourself from having diabetes. So we know that obesity is a huge risk factor for diabetes. So if you're overweight, I suggest that you work with your doctor or you call us and we can help you get to a healthier weight. If you're on a lot of medications for any disease, remember that many medications, metformin, Cipro, all these analgesic can give you kidney failure. So you need to try to protect yourself from being on too many drugs. And next, if you have high blood pressure is the second most important cause for chronic kidney disease. So if you have hypertension, then you need to seek special attention so that you can lower your blood pressure and protect yourself from chronic kidney disease. You can call us. Our numbers will be there on the screen. Call us, call Dr. Levine if you have more questions, or if you want to protect yourself from getting chronic kidney disease. Now, Doc, what's the treatment for chronic kidney disease? A lot of people are afraid of the word dialysis. Okay, so let's talk a little bit about the treatment.
Yes, initially only we modified factors that can affect the kidney, like if you're not drinking enough water, we tell you drink water. There are medications that might be affecting your kidney, we remove those medications. At the end, when your kidneys don't work, we talk of dialysis. So hemodialysis, it's like a filter. The kidneys are filters.
Right.
And when the kidneys don't work anymore, all the toxic products
stays in the blood.
Stays inside the blood, and that makes people sick. So basically, dialysis is like a filter, get rid of all of that. And
let's look at the screen here. We use this as our filter. Here with the hemodialysis, the blood goes through a filter. So we're going to wash the blood out, say in common terms. Wash the blood and remove all of the poisonous substance. So the patients are hooked up in a machine, if it's hemodialysis, maybe 3 times a week. The blood flows through the filter, gets out. So we have the unclean blood and the clean blood coming out. And a lot of patients don't want to do that dialysis. Now we also have the peritoneal dialysis, which is similar. The water is pumped into the abdomen, right?
That's correct.
It is filtered there.
Stay there for about 2 hours.
Right, and then remove. So therefore, if you really want to prevent yourself from getting the disease, then listen to the risk factors and try to stay healthier. Doctor, is there any last minute word you want to give to our audience about chronic renal failure?
Yes, we need to make sure to change those factors that can cause kidney failure. The main objective is for you not to end up on dialysis. And that's where the kidney specialist plays a big role.
Right, so it's either dialysis or transplant. And then with transplant, then the patient needs to be on medication for the rest of their life, suppressing the rejection of the kidney. It's too complicated, guys. So if you want to live healthy, remember that simple lifestyle changes are important. Healthy nutrition, exercise, rest, drinking enough water, relaxation, and trust in God. Doctor, thank you so much for being on the show. I'm sure I'm going to have you back again.
It's a pleasure, anytime.
Don't go away, we'll be right back after this short break. Hey, do you have high blood pressure, diabetes, hypertension, cancer? Welcome over to Cooper Wellness Center. We have raw organic juices filled with vitamins and antioxidants, good for any diseases. So come over to Cooper Wellness Center and ask for one of our juices, and we will serve you up something that will give you long, healthy life and help you to lose weight and get off your diabetes medication. Come to Cooper Wellness Center.
Now it's our turn to take care of those who saw and helped us grow. Their time is valuable. It is time to think of a professional staff who will help take care of them. We at PalliMed Hospice and Palliative Care are the right choice. Our staff and 24/7 services are trusted and reliable. Call us. We are the solution you and your family need. We understand you. We are PalliMed Hospice and Palliative Care.
And we're back with Get Healthy with Dr. Cooper exercise segment. We all know that 30 minutes of moderate exercise daily can keep many diseases away. So at this time, I'm going to have Ramsey come over and tell us what he has for us today. Hi, Ramsey. Welcome. What do you have for us today?
Today we have a resistance workout. It's going to be upper body based. We're going to focus on just upper body today. This band, resistance band, you can get it at your local store, sporting goods store. There are better bands, but this is just something basic so we can get you going, okay? Where we have Denise and Cynthia. Cynthia's gonna be showing us our advanced. Denise is gonna be showing us our basic. So we're just gonna start off with a overhead push out. There you go, just nice and basic. The basic person is just gonna do it nice and easy. Open it up, Okay, good job, good job. Now on the advanced portion, we're gonna bring it down into a press. Close enough the grip so you get most resistance. Close in your grip so you get the most resistance. There you go. Good job. Good job. Good job. Nice, 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 okay? So this one, we're both gonna try to do it 4 sets, 20 times. This is just a great warm-up just to get you into the exercise. After that, we'll proceed into the next thing. Next, now we're gonna go back to the straight band. Straight band, now what we're gonna do a bicep curl. There you go, set it up, step on it. Make sure, for us, we don't have any handles, so try to get a handle or tie it to a certain way, wrap it around your hand, do what you can. Denise is just gonna do it nice and simple. Come all the way up. There you go. Regular sets, regular sets, regular sets. Regular set's gonna be 4 sets, and we're gonna try to go 15 reps, for sure, 15 reps. It's gonna be nice and simple. The resistance is gonna be gonna increase as you go higher, but we can handle it. Now on the advanced side, we're gonna isolate. We're gonna isolate, hold for 30 seconds. Now this is gonna bring a different feel to the workout. It is new, so really focus on holding it. Again, we want it 8 times. 8 times, 4 minutes. 4 minutes, okay? Next, we have triceps. Triceps is gonna be the same thing for basic and advanced. We're gonna step on one side since the band's a little bit too short for us. Now we're gonna come all the way up. Focus on it. Again, we don't have grips, so if you have something with grips, it'll be a lot easier. But focus on extending that tricep up and keeping it back. Focus on keeping it back. Just like how these ladies are doing it, they're trying to sustain it and keep it going straight up and sustaining it the whole time. Good job, good job. Again, this one's gonna be a single motion, so we have to do each arm 15 times, each arm 15 times, 4 sets, 4 sets, okay? Now we got a push-up. A push-up, for a lot of people, they can't do it, but if you can, push yourself to do the push-up on the floor, but if you can't, we're gonna do something like this. Denise, go ahead and explain it. Do it, there you go. All the way up. And we're just gonna do it off with our body, coming straight out. Boom. There you go, there you go. For advanced, we're gonna wanna wrap it around. We can do it on the floor, coming straight down. And we're just gonna go all the way down, all the way up, all the way down, all the way up. It does add a little bit more resistance on the way down and the way up. So really focus on doing this as much as you can. Again, this was gonna be, for the advanced portion, do 4 sets, 4 by 15. If you're doing the basic, really push that 25. It's not gonna be too hard, but just be careful and not leaning back too much. So that's what we have for our segment.
Thank you so much, Ramsey.
Thank you, Dr.
Beautiful. This is very simple, everybody. You can do this in the comfort of your own home. Don't go away. We'll be right back. Thank you.
Thank you.
Now it's our turn to take care of those who saw and helped us grow. Their time is valuable. It is time to think of a professional staff who will help take care of them. We at PalliMed Hospice and Palliative Care are the right choice. Our staff and 24/7 services are trusted and reliable. Call us. We are the solution you and your family need. We understand you. We are PalliMed Hospice and Palliative Care.
Hey, do you have high blood pressure, diabetes, hypertension, cancer? Welcome over to Cooper Wellness Center. We have raw organic juices filled with vitamins and antioxidants, good for any diseases. So come over to Cooper Wellness Center and ask for one of our juices, and we will serve you up something that will give you long, healthy life and help you to lose weight and get off your diabetes medication. Come to Cooper Wellness Center. Welcome back to Get Healthy with Dr. Cooper. And you are in the kitchen segment. I have Chef Edgar. Welcome, Chef Edgar.
Hey everybody, how y'all doing? Welcome to the kitchen segment.
That's right. This is the chef segment. I'm just here to assist. We have something very special for you today. Chef, what do we have?
We're going to do huevos rancheros without the huevos, without the cholesterol, but the same or more intense, amazing flavor.
That's right, with great quality protein. You know, we have been discussing chronic kidney failure, which is a fearful disease, but you can prevent it with certain lifestyle changes, with even the food you eat. Chef, let's show them how to eat eggs without the cholesterol.
Without the cholesterol, that's right. We're going to do this amazing, amazing dish. We're going to start off with our onion, okay? We're going to dice this onion. And again, the closer your lines are, the smaller your dice will be.
And you know, onions are great for inflammation. So if you want to prevent inflammation or even to boost your immune system, then you should probably add more onions to your meals.
So, our onions are ready to go into our pan. We have 1.5 teaspoons of oil. This will go into our pan. Our pan has been heating up for us. Okay, so we have our oil. That's the only oil we will need for this dish.
You notice we're using a small amount of oil because oil has a lot of calories. All right, there you go, Chef. What else, Chef?
Now we're going to put our bell peppers in. Okay, bell peppers. Now cut these little wedges out.
Bell peppers are great also with vitamin A, and the red bell peppers also are just wonderful with lycopenes. Lycopenes can prevent certain cancers like lung cancer and prostate cancer.
Again, keep our fingers together, keep our fingers in. We took the seeds out. We're going to cut little wedges, but we're going to dice these right now as well. And onions and bell peppers go extremely, extremely well together.
All right, Chef.
So our onion is going and getting nice and brown, bringing all that sugar out, okay? And see, we don't need that much oil. Vegetables itself are helping us out. Now we're going to put our bell peppers in.
All right. What else are we going to be adding?
Now we're going to add our tomatoes, get those going, get those nice and cooked.
There you go. Beautiful.
Tomatoes also have been diced. We let the seeds in there. We left everything in there. Okay? So we got onions, bell peppers, tomatoes already in here.
All the colors bring different vitamins and nutrients, so you should have your plate with different colors. All right, Chef, what else?
Now we're going to invite our tofu in here. For those of you that do not know what tofu looks like, what tofu is, this is our chickpea curd. Okay? It comes in a package with a lot of water. We have taken that water out. We've squeezed this. We've taken as much moisture as we could out. This is whole. We're going to crumble it up, put it in our dish, and let the onion flavor, bell peppers, tomatoes, everything come into this sponge-like texture, and everything is going to work amazing together.
This is soybean curd, very high in quality protein. So don't hesitate to use tofu in your diet. Very healthy. There's a lot of myth on the internet about tofu. Don't let it scare you. Tofu gives good quality protein. All right, Chef, what else are we going to be adding here?
We have a lot of spices, but we'll go through each one right now, and they're important. And they're great for your health as well.
That's right. I already mentioned the turmeric. It's made from curcumin. That is a root that is filled with a lot of health benefit. Good for joint pain, good for inflammation, will build the immune system. Great antioxidant as well.
I put some garlic in here as well. Okay, that's been diced up. I have a large garlic clove. We also have jalapeno that will be going in here as well. This is one small jalapeno, okay, because it is huevo ranchero, so this has to have a nice little kick to it.
That's right.
2 tablespoons of nutritional yeast. This gives you amazing flavor.
That's right, as well as the B complex vitamin, especially vitamin B12. All right, Chef, it's all coming together now.
Everything's coming together. We have 1 teaspoon of cumin.
All right, beautiful flavor there from the cumin.
This right here, for us South Texas, this is our go to flavor. And now we have half a teaspoon of turmeric.
Right. You all should have turmeric at home because of the wonderful nutritional benefit that this herb has. All right, what else do we have? We're going to make this come together now.
Everything's coming together. And now we have our savory salt. We have 1.5 teaspoon of savory salt.
Right, and you can do salt to taste. Remember that too much salt can lead to high blood pressure. High blood pressure is a risk factor for chronic kidney failure. And that is what we presented on our show today, so we have to be very careful with the salt. But then, if your food doesn't have enough salt, it will be too bland. So you'd go salt to taste.
And that's what everybody says. Plant-based is bland. No, it's very flavorful. It's the best thing you can put into your body.
That's right. Food should be your medicine, but food can also be your greatest enemy. So you have to be careful. I think we are coming together.
This is pretty much done. We're going to add some cilantro right here. This, once you start cutting this up, your whole kitchen is going to smell like cilantro.
Smells really good, chef. And how are we going to serve this tofu here?
If we are talking about South Texas, we're talking about huevos rancheros. The only thing we could serve it with, doctor, is some tortillas.
Whole wheat. Now remember,
whole wheat tortillas.
Not white flour. We need to get the whole grain that has more nutrients. All right, chef, go ahead.
Ooh, this looks like huevos rancheros. Make sure all the flavors are going and getting to know each other.
Really delicious.
Well, we are going to finish these tacos off with the only thing that we could finish them off with. Again, we got jalapenos in here, but it's not a taco if there is not a salsa with it as well.
All right, so let's put our salsa on.
We've made a salsa right here, and we're going to top it off with the salsa.
So, go to my website, get the recipe, try this at home. Until then. Hey, do you have high blood pressure, diabetes, hypertension, cancer? Well, come over to Cooper Wellness Center. We have raw organic juices filled with vitamins and antioxidants, good for any diseases. So come over to Cooper Wellness Center and ask for one of our juices, and we will serve you up something that will give you long, healthy life and help you to lose weight and get off your diabetes medication. Come to Cooper Wellness Center.
Now it's our turn to take care of those who saw and helped us grow. Their time is valuable. It is time to think of a professional staff who will help take care of them. We at PalliMed Hospice and Palliative Care are the right choice. Our staff and 24/7 services are trusted and reliable. Call us. We are the solution you and your family need. We understand you. We are PalliMed Hospice and Palliative Care.
Welcome back to Get Health with Dr. Cooper. So we have been discussing chronic kidney disease. This is a disease no one wants to have. However, in the United States, 250,000 people are diagnosed yearly with this disease, and globally, 2 million people are diagnosed, and many of whom have to use hemodialysis or peritoneal dialysis. Some patients are placed on transplant list. What do you want? Do you really want to have renal failure? We know that there are many diseases that increases your risk for having this disease. Diseases such as diabetes, the #1 culprit for kidney disease, hypertension, drugs, and other diseases. Today, I ask you to take care of your health. Remember, a healthy lifestyle can help you prevent, reverse, or cure many diseases. You have listened to the risk factors and the treatment. I want you to follow us. Follow us at our website. Continue to watch the show. Follow us on Facebook. And most importantly, there is always hope. In 3 John 2, it says, "Beloved, I wish above all that you prosper and be in good health." So take hold of this And remember, your Heavenly Father wants you to have good health. So until next week, may the Lord bless you richly.